This is Speaking of Pets podcast, where we give you up-to-date, accurate, science-based information when making decisions about your pet's health.
From experts in dermatology like my sister, surgery, internal medicine, CBD use in pets, the pet food industry, you name it. If it affects pets, we'll talk about it.
Today's Speaking of Pets podcast is sponsored by Blue Buffalo, the maker of natural pet foods. Love them like family, feed them like family. Blue Buffalo offers wholesome, meat-first recipes with high-quality natural ingredients in flavors dogs and cats love. Discover formulas for all breed sizes, life stages, and lifestyles. And with Blue Buffalo's True Blue Promise, that assures that real meat is the first ingredient, with no poultry byproducts, no corn, wheat, or soy, and no artificial flavors or preservatives. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary allergist and dermatologist. And
I'm Janet Novotny-King. I am not a board-certified allergist and dermatologist person. I am your regular pet owner and lover, and I'm here to kind of dumb down these two doctors when they talk so we can understand what the hell they're saying.
Well, you know, Janet, we've been getting a lot of questions about acupuncture, about veterinary chiropractic, which is a subject close to your own heart, which we'll have to mention to our guest today. So we're very fortunate today to have Dr. Neal Sivula, who is an integrative veterinary medicine specialist. He got his DVM degrees at Buckeye from Ohio State in 1988, someone actually a year before me. Yay. Yeah, thank you, Janet. He
You're
then
welcome.
went on to do an internship and residency in large animal internal medicine at University of Minnesota, at the same time getting his Ph.D. in veterinary medicine and epidemiology. And you know what Daddy would say about that. He's a smart cookie. Anyway, he started Dancing Paws Veterinary Clinic in 2001 because of
Oh my God, I thought you were going to say you started dance class.
No, but maybe he dances. We'll have to ask him. Dancing Paws Veterinary Clinic in 2001 because of his interest in holistic health. He is
Awesome.
certified in so many areas of integrative veterinary medicine, like an advanced certification in acupuncture, animal chiropractic, a certified veterinary food therapist, certified veterinary Chinese herbalist. He's also recipient of several awards. He was inducted into the Animal Chiropractic Hall of Fame in 2023. And this year received the Lifetime Achievement Award from the American Academy of Veterinary Acupuncture. So, Janet, I know you got tons of questions for him. But in addition to being a clinician, he's a professor, a webinar manager, and a podcast host, like the two of us.
Which is why his background is so fabulous.
Yeah. For the College of Integrative Veterinary Therapies, which provides evidence-based education for veterinarians, veterinary nurses, and the public in all the areas of integrative veterinary medicine. So my first question to Dr. Sivula is, please tell us, what is integrative veterinary medicine and how did you get started in it? And welcome.
Sure. Thanks. It's great to see you guys.
Yeah.
Integrative means a number of things to a number of people. For us, it's because we consider ourselves a member of the healthcare team for the pet, and what we're offering isn't an alternative, solely on an alternative therapy for the pet, but we're interacting with the primary care veterinarian, the specialist or specialists that might be involved in the pet's care. And so we're one part of the team. Other integrative veterinarians may do that in their own clinic. They may offer traditional medicine and surgery, as well as holistic or alternative therapies, complementary therapies, a lot of different terms. But for us, it just means that we're really firmly entrenched in working as part of the pet's care team.
Janet, tell Neal why you love your chiropractor.
I love Dr. Andrew Ilowitz. He's a dear friend. And I have to be honest, it was originally my orthopedic surgeon sent me to him, this very big deal orthopedic surgeon, because I had something going on my neck. And I went into Andrew's office and I was all like, And Andrew said,
"You don't believe in a nutshell, or is this like 20 years ago?" Okay.
Okay, so hold on. So Andrew's like, well, you don't believe in this, do you? I said, look, I lived in California. I saw a lot of people screwed up from bad chiropractic work, and it's true. And he goes, listen, just work with me. And he has helped me first of all, he discovered that I had Lyme more than and Alice. They've never even met, and they
Two
figured
of
out that I
us.
had Lyme and Bartonella. And he's the one that sent my blood work to Igenix Lab, et cetera. And then I just had another gut issue, and he sent something else to another lab, which discovered a bacteria. And I sent it to my medical doctor, like, you need to treat this. And she was kind of shocked. And I had to go through about another big test to finally get the freaking Cipro. So anyway, I love my chiropractor because,
All
and
right.
it's sad we call it alternative medicine. I like it better as it's team medicine.
Right.
Yeah.
Because alternative sounds like you've gone down every path and now I got to go here.
Mhm.
Because to me, it's not
Mhm.
that. So, and I
Right.
think with pets, it's even more important.
Yes. Totally agree.
But
Back when I started, that was the thinking was that, the practitioners that did what I do were alternatives, and you're right, kind of the last stop. And, we do everything uh, the opposite of what an allopathic veterinarian would do. And it's just not that way anymore.
Yeah. Well,
Janet.
we grew up,
Oh, go
Alice,
ahead.
we grew up going to a say it,
No,
nathrop.
well, Neil doesn't know this, but we like kind of walk the walk and talk the talk. Our mother was into natural hygiene. I was brought up on goat's milk because my older
Ah,
sister had asthma, so my mother got her off of all dairy. My mother was really
yeah.
before her time and criticized
Mhm.
by a lot of people. When
Yep.
we were sick, we were fasted. We were never vaccinated for anything. So when I went to vet school and I was rabies vaccinated, I got really sick because I'd never had
Oh, wow.
anything like that. But
Yeah.
we were brought up on carrot juice. She used to go downtown to the commission house and buy
Mhm.
crates of oranges and carrots, and we weren't vegetarians, although I am now,
We
but
were
we were
really
close.
close.
Yeah, we were close to it. But the problem was Janet was a bonus. Okay. My mother had her when my mother was 43, and my mother was
Five,
just all
45,
tapped out.
45.
Stop it. And so she had to fight with Janet to like even have a shot glass of carrot juice. So then
Hate
she
it.
was like, I'm done with it. But that's our histories. Oh, and we also went to a farm in Gates Mills to buy raw unpasteurized milk. So,
Ah,
yeah. So,
yeah.
It's
yeah,
kind of weird, but we're super healthy.
yeah. But anyway, that's kind of our history as the Novotny sisters because we my a lot of people thought my mother was crazy. And like
Mhm.
a lot of
Yeah.
our relatives did. Which is why we never associated with them because of her. But anyway, so yeah. But Janet, Neil also does water therapy. He's got a water tank.
Oh my
You
gosh.
still do, right, Neil?
Yes. Yes.
Wow. So,
So
okay,
we
so
use that on.
go
Yeah.
ahead.
Go ahead.
No, our sister Penny had a dog that she did chiropractic work on. Did you know that, Alice?
No.
I forget, it was the Chow Mix one. And the chiropractor taught her how to do, like, every day. She did these multiple movements and stretches with that dog, and it improved that dog's life
Mhm.
tremendously. So, how do you get the canine patients, not the human patients, the
Mhm.
canine patients to comply?
Oh, it's pretty easy. They're looking for help, and even if they're painful, the techniques are so gentle um, that I've never really, in the longest time, had any issue. We're actually burdened though with there's some characters on the internet on YouTube that really do some drastic things that they call chiropractic, and some owners come with the idea that that's what it's going to involve, and it really doesn't. And so um, it goes really well. It goes
Wow.
really well.
Well,
And do you prescribe supplements, like herbal supplements, things like that too?
You bet. Yes,
Wow.
absolutely.
Wow.
The bulk of our clients find us from word of mouth from other clients, but we've been fortunate enough to be in the area for long enough that we have a good relationship with a lot of veterinarians. And our practice used to be um, in the specialty hospital in Metropolitan with one of your previous guests, Dr. Paget,
right.
and so we've got a little familiarity from being with them, but it's just been a lifetime of building relationships. Yeah.
Neil, and isn't that the truth? I've always thought it was very unprofessional for medical people. I don't care what the medical profession is to advertise. And you and I have never had to advertise ever.
Yeah.
It was all,
Yeah.
I always say, if you practice good medicine, you'll be busier than all get out. And I think
Mhm.
that was true for both of us.
Yeah. Yeah. I can remember back years and years ago, my practices I worked in where they would, the big yellow pages ad, but
Yeah.
yeah,
Well, if you build it, they will come. My chiropractor doesn't advertise. He has 3,500 clients,
Right.
Yeah.
But
and I've probably
Yeah.
sent 100 people.
the thing with Dr. Sivula, Janet, any vet can take a weekend course in acupuncture, and that and say that they're trained in it. And to me, that's false advertising. I mean, he is certified in it. You know what I'm
Right,
saying? Yeah.
right, yeah.
Neil, I had a shepherd that I found hit and left for dead on Route 18 many years ago,
Hmm.
Katie, and she ended up getting degenerative myelopathy at the end.
Yeah.
And I took her.
Yeah.
Do you remember Bob Montgomery in New Philadelphia?
Sure. Absolutely.
Yeah,
Yeah.
and Bob said to me, he said, "Alice, I've never had this happen for degenerative myelopathy, which is kind of a loss of the nerve innervation, if you will, in the hind legs. They still are continent. They still, they pee and poop, they control that. But their hind legs just kind of knuckle over." And he said, right from the get-go, "I've never really had this help with this." I said, "But I need to know I've done everything." And so I think we had
Hmm.
13 treatments and she loved it. She just sat there like a
Yeah.
little princess, and he put the acupuncture needles in, and he and I visited, and it was a very calming, lovely experience.
Yeah. I bet. Yeah. We see a lot of those degenerative myelopathy cases, unfortunately.
Yeah,
So
isn't that something?
what is
Now,
go ahead.
Neil, when I'm sometime passing, because Janet, his office was catty corner to mine, across the
Oh,
street. Okay.
oh,
And across from the Tavern of Richfield on the other side. But I
yeah.
often see police dog cars there. Do you do a lot of police dogs?
We do. They're just high performance animals, and their handlers really want the best for them. So that's a service we provide to them at no cost, just as a
Oh,
public
wow.
service. And
Oh my
we love to see those handlers, and we love the dogs, and they do such great work. Yeah.
So what's the most common thing that you see with your patients, with the dog?
Well, because our practice is limited to the holistic therapies, we see a lot of geriatrics. So
God.
arthritis, neurologic problems are probably the two biggest things. Cancer would probably be number three.
Wow. What have you found that helps for cognitive disorders in dogs?
Cognitive disorders, we address their nutrition, make sure that they're feeding something proper. And there's some supplements that have been helpful.
Hmm.
We do acupuncture for those dogs as well.
Oh
Yeah.
my gosh. Wow. Huh.
Do you ever have pet owners who are just not believers?
Oh, all the time. And the we'll get owners that are skeptics, of course, and if they can give us some time to work, like you had mentioned before, sometimes we're the last chance, and so
Hmm.
if we can convince owners to give us some time to get things going. And the other difficult thing is sometimes we'll have spouses that have opposite opinions.
Oh, I know.
So
Isn't that the truth? Yeah. Yeah. You
They
yeah,
know,
become like a
And
marriage
Neil,
counselor.
well, I don't know how you feel about this, but I used to feel that a great portion of my time was getting dogs off of steroids because of all the
yeah,
muscle atrophy and everything. And I get that some dogs had to be on those, but there were still alternatives to those. And they would
Wow.
come
yeah,
in just, a 5-year-old dog looked like it was 25. And
yeah,
when I was able to get them off years of steroid, and the owner would tell me, "Hey, this is the first time they picked up their ball and played with it." Oh,
yeah,
and I'm sure you see that because you try to
yeah.
rebuild that muscle atrophy, and years of steroid, it's a crime.
It is. It is. And, we look for those little things. You've probably heard those stories where, the pet hasn't been able to go upstairs into the bedroom for years, and one owner is sleeping on the couch with the dog. And if we can make those little changes where they can go upstairs and go to bed or sleep through the night, and,
Mhm.
it's huge. It's
Mhm.
big.
That's the marital problem right there.
That's what?
That's the marital problem right there, sleeping on the couch.
Yeah.
One's upstairs, one's on the couch.
Are the police dogs pretty nice to work with? Because I know when they come in, they're pretty on guard, and whatever they're German trained or Czech trained. So I would I would never give a command. I would always have the officer give the command, seats, blind pots, that kind of stuff. And then I would do my
Yeah.
thing. But it can be challenging.
It can be very challenging. And, you've seen probably over your career where the officers went from German Shepherds to Belgian Malinois, and those dogs are just very high strength, they're just very energetic and high, high test. And, so yeah, we definitely have the handlers uh, do everything with them. They never leave the sight of the handler.
Mm-mm,
And,
mm-mm,
and, some of them can be a little spicy, but,
mhm.
we've always had good luck with just the handler there, and the handlers know they can trust us, and then the dog learns that they can trust us too.
Yeah.
Have you ever worked on like exotic animals, or is it always just, pet usual pets?
I've got a couple of bunnies from Richfield right now that are that are coming in.
Really?
What's wrong
Um,
with them?
Playboy bunnies.
arthritis. Yeah,
Oh, are they very old?
yeah, yeah. We've done some duck on occasion and some iguana. We did a puma when we were at Metro. One of Dr.
Really?
Riggs. Yeah, one of Dr. Riggs's patients. Yeah.
Was it privately
Oh,
owned or was it a zoo animal?
It was privately owned.
Mm.
The backstory was that someone purchased the cat and didn't have any idea what they were doing,
Oh.
and were feeding it an unbalanced diet, and
Oh.
had some nutritional issues, and so it passed to another owner who was experienced, and they brought the cat to Dr. Riggs, and but it had a little quick stay at Metro while it was getting assessed.
I think nutritional deficiencies are like the number one horror for people that adopt exotic pets because they think, oh, an all
Mhm.
meat diet, and these poor turtles on all meat diet. Then they get calcium deficient. It's just horrible. Absolutely horrible.
Yep.
Mm.
what would you feed a turtle? Is there special turtle food?
Hmm. Hmm.
Oh,
Yeah.
like pellets or something?
Yeah.
Huh.
And they like different fruits. They like strawberries. I just rescued two turtles the other day, by the way. Turtles are crossing because, they're going to lay
Yeah.
their eggs. Yeah.
Yeah.
There was one on Instagram where they put it on a little skateboard.
Oh, yeah.
It went like this and it chased the dog through the house. I was dying. It was hysterical.
At Crow, where I volunteer in Sanibel, Clinic for Rehabilitation of Wildlife, we've done that with some of our gopher tortoises. Hey, and let me tell you, they're fast. Because we'll take them out in the yard to exercise them, and they, emotional. They need fresh air, and they like to chew the grass and stuff. And you'll turn your head, and you're like, oh my god, where is he? Because they can be pretty fast. So can I when I see a snake.
Yeah. We actually spell that word Snake. I'll be
Yeah.
out in the yard. Snake.
Yeah, yeah, yeah. Hey, did you know that for dogs and cats that could benefit from a prescription diet, Blue Buffalo offers natural veterinary diets formulated by animal nutritionists and veterinarians for certain dietary needs like kidney support, weight management, gastrointestinal support, and my particular favorite, dermatology. They make a food allergic diet that's an alligator based called NP or a hydrolyzed salmon based for dogs and cats called HF. Contact your veterinarian about these prescription Blue Buffalo diets. So,
Dr.
Dr.
Sylvia.
Sivula, what pets do you have?
Yeah.
We have 4 cats at home here. We have 2 pit bulls that we rescued from the Cleveland APL. So Dr. Lash is a friend,
Yes.
and then we've got 6 cats at the office.
Oh, I was
Oh my.
wondering if you had office cats. Okay.
Oh yeah,
Is that like a thing?
Yeah.
yeah.
And I'll tell you, Janet, and Neal will agree, when, when you lose an office cat, because, you come in, you see them every day, they're like your family. They're your workmate, but they're your family. It's really hard. It's so sad because they're there every day and then they're not there. And yeah. Janet, tell Dr. Sivula about Libby, about her problems. You probably should have seen a chiropractor for her.
Well, no, Libby's great. So Libby is our golden that Alice rescued for us from
Golden treasures.
Golden Treasures,
Okay.
and she had been in a puppy mill and had escaped and had been hit by a car, a truck, whatever, and was on the side of the road. And Dr.
Mark Day.
Bay, he did that
Yes.
thing where you take the femur thing, and you wouldn't even know there's anything wrong with it. What they
The
cut it
head of the
right,
femur. Yeah.
but
Yes.
she is physically active. She's unbelievable. She's 3 now, and she has no issues. She rocks and rolls, but she does like a good hip massage.
Yeah. I bet.
She does, but she hates being brushed.
So do you think, Neil, she should be on any supplements for that, or falls a false joint, or what?
It does form a false joint, but if you think about the rest of her, I would I would recommend that she's on some good, of course, a good diet. We got to start there, and some essential fatty acids. And I like glucosamine for these guys.
Oh,
Okay.
she's on
Uh,
glucosamine. She came with that.
All right, that's
Mhm.
a good start.
You know,
But you just have to worry about the wear and tear on the rest of her.
that's
Oh, because
true.
it's taking a
On the
little more
bloodlet.
than.
Neil, I read
Mhm.
Hmm.
somewhere that the dose of glucosamine chondroitin in dogs should be higher than in humans. Is that true? And I don't remember.
Yeah, per pound.
Is it? Okay. I thought I
So
did.
what is it per pound? Because hers, I just give her a tablet.
Yeah, if you're using commercial product for dogs, they're going to have you right in the ballpark where you need
Oh,
to be.
Oh, okay.
no.
Good to know. Good to know. So, okay, so Dr. Sivula, here's our question. What is
Okay.
your pet or human peeve?
um, I think our biggest peeve would be, unfortunately, we want clients to be able to listen to instructions from their regular veterinarian, not necessarily us. We'll get new patients in that have been prescribed things from their veterinarian, and they're not so compliant. Maybe they have a bit of a reaction, or they don't like the way the pet looks on the medication. Instead of communicating with their veterinarian, they just stop the medication. And I just would like to see a more open communication line between us and our owners. And
Mhm.
so we try to encourage that. So it's not necessarily a peeve. It's just
Mhm.
something that we really encourage, is that it's just good practice.
That's great.
Can I
That's
make a
great. So,
comment on that, Janet? I would get people in and I'd say, "Well, how's he doing? How's he doing on the medication?" "Oh, I'm not giving it." And you just wanna scream, "Well, then how do you expect him to get better?" But I didn't, obviously. But really, I mean, how do you expect him to get better if you're not giving now, if you can't give it, that's fine, but Neil's right. Then call me. Please, we'll come up with another idea. Just don't not do it, and then you're really wasting your my time and their time coming in for a recheck when there's nothing to recheck.
well, and you told me, Alice, like you'd say to some of your patients, only give them lamb and rice because you're trying to see what they're allergic to,
That
right?
was 20 years ago. Yeah, that's not
But then,
20 years. Yeah.
then they'd say, well, what about Fluffy's special treat? No, only lamb and rice.
Well,
Like
yeah.
it's just,
And to take that one farther, you put them on what we call a prescription hypoallergenic diet, meaning with, very few ingredients at all. Then they would see, for example, chicken fat on the back, and they would think it's okay to give chicken. But see, you really have to, first of all, never assume, and then secondly, kind of then assume if something bad's going to happen, it will. Meaning when they read that chicken fat, okay, then I can give chicken. So
oh.
it's tough, you know?
Well, we
Yeah.
actually, Dr. Sivula, we grew up having bunnies, Easter bunnies, real bunnies as pets.
And
Yeah.
ducklings.
And ducklings, yeah. And then at school, they would, they did the whole egg thing where you hatch eggs, you keep turning them. So we'd have,
Yeah.
I had two chicks I brought
Oh,
home.
I didn't know that. I must have been gone out of the house.
Yeah. So we had like a menagerie, if you will.
When Neil, you said you saw a duck, what was that for? Limping?
Arthritis. Yes.
Oh, oh,
So
Yeah.
wow.
Question. How does acupuncture actually work on an animal? Like, are the needles different, and how do you get them to stay still for that?
The needles are the same as people. There are various sizes of them. And so we can pick based on where the point is and what kind of animal we're using. And I'll just complicate the matters further by saying I use a laser to do acupuncture. So I don't use any needles whatsoever most of the time. Um, but we explain it to clients that it works in two ways. From a medical point of view, if we're thinking traditional medicine, those points can be near nerves that just signal the brain to do whatever it is we need it to do. So whether that's help with stiffness, um, help with some sort of organ function, we select those points based on that idea. In Chinese medicine, it's basically related to how energy flows through them. So, for instance, a dog with a bad hip, because
Mhm.
an arthritic hip, the energy won't be flowing well through there, and so we pick points to get it to flow better. So there are a number of different philosophies on how we pick the points, but once we get those points selected, we can use needles. And I was going to ask you, Dr. Jeroman, if Dr. Montgomery used B12 injections. He was famous for using B12
He
injections into
didn't.
acupuncture points.
Yeah, he
Okay,
didn't that I know of. No, he didn't that I know of, right.
yeah.
So
So
wait.
that's another way of stimulating the point, is to inject a liquid at the point.
Oh,
But the needles stay in unless it's a chow chow. Those chows are notorious for having slippery skin and throwing the needles out, but they stay in pretty well. They stay in pretty well.
So how does the laser work?
The laser just stimulates the point in the skin with a laser beam instead of a needle.
Does it remove the dog hair?
No, 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 not whatsoever. It's a therapeutic laser. So
Wow.
yeah.
So our niece does a needling. Do you do needling as well with animals?
So does she do dry needling, or is
Yes.
she? Okay, so that's a different philosophy. That's putting needles into areas that are in muscle that are sore, into trigger
Yes.
points.
ah,
Mhm.
Yeah. So our acupuncture points may be located in a trigger point, but most times they're not. So but it's to the owner or the patient, it looks similar because a needle is going in the skin.
Right.
But with that dry needling, if you've had it done, that can be a little uncomfortable when that needle goes into a trigger point. So,
Yeah.
around our place, we like the treatments to be happy.
yeah, yeah,
So
yeah.
we'll do that if we need to, but we try to keep it real fun.
Do you use the ultrasound wand too? Is it an ultrasound wand, that heated thing?
Yeah, we do have a therapeutic ultrasound. Yeah,
That's amazing.
yeah. You bet. Yeah. So we'll use points that are close to an area of concern, but there'll be a lot of points that are far away from the area and we can explain that both from Chinese medicine, but the neurology has really been borne out to show us that those points can really be helpful, the ones that are far away. Yeah. They stimulate reflexes that we need to help control that pain and improve that stiffness.
You
Wow, that's
you
fascinating.
know, Janet, you've heard of reflexology of the feet. Is
Oh,
that
yeah.
is that true also, Neil, for pets? I mean, they have tiny feet, but I find that fascinating.
Oh yeah.
Yeah,
Yeah. Yeah, there are points. Some of the most important acupuncture points we use are on the feet.
cool.
Wow.
Oh, I
Like on the
Yeah.
back part?
On the toes, on the top of the toes.
Wow.
oh,
Yeah.
huh.
And for us too,
Oh, absolutely.
for people too. Yeah.
What about in humans? I think what another thing that's cool is lymphatic massage. Do they do that?
Mhm.
Do you do that too?
We used to do massage. We're like everyone else, we're having trouble with staffing, and so we
Oh,
used to have 2 or 3 assistants that were trained in massage, but at present, we don't have anyone, and I love
mhm.
to offer that. So we're working on it because I think it's one therapy that we can do, the assistants can do in our office that makes a huge difference for our patients. So I teach some clients how to do some things at home, but that is you're hitting a sore spot there because I really wish that
Mm.
we could offer more in the office. We'll get back to it, but
Yeah.
it's just been a struggle.
I just think it's so cool how many parallels there are. Acupuncture in pets and in humans, the lymphatic massage, the reflexology. I mean, you really, when you think about it, Neil, you were really ahead of your time. Think about it, because back when you started all this, no one was doing this. Okay, Bob Montgomery. I don't even remember what year that was. Probably early 90s.
Yeah,
Yeah. But there
yeah.
really was no one around. And this part of veterinary medicine has really grown. I love that it has, because to me, the less drugs, the better.
If we can just offer those other things, for those pets that need extra help, it's been great. Yeah.
How far away do people travel for treatments for their pets?
Well, that's why it's nice to be where we are, because we're next to the interstate, and we get people from Erie and from Youngstown and from out towards Sandusky. And when I started, there were fewer people doing this, but and now there are more. But we're fortunate that we have clients from those areas that really um, can come and easily get to us because of our location. That's why we love where we're at.
So I have a question. What's the worst thing you could feed your dog? Like, what's the worst thing that people give their dogs for their health?
Yeah, their base is a balanced diet, and then you're just adding some great stuff to it.
Mhm.
That's wonderful.
I'm also not a big proponent. I don't know how you feel about this, Neil, about treats. I think a lot of them, like pepperoni. Okay, there, I said it. Is a lot high in sodium. And I told you the one time Mr. Jeroman bought treats for our trip to Florida, and we got there, and Tawny, one of our rescue Goldens, was peeing and drinking, and I had her worked up for everything, and here it was the treats. So
Yeah.
I just use my dog food as treats, because some treats have as many calories as a Snickers bar, or you can
I
use
get it.
Yeah.
or fruits and veggies as treats. Correct, Neil?
Yes. Yes. And that's the one thing we do. We don't carry any food in our office any longer, but we do carry some nice, good quality treats, and people love that. They want to seek that out because they want to do the right thing.
Yeah.
They
Right.
just need help.
Yeah,
Right.
they need, what they need, and that's what the whole reason we started the podcast. They need misinformation corrected, because you can
Yeah.
read, like you said, you can get a diet on the internet. And I had a woman that was fostering chocolate lab puppies, very proud of the fact that she was feeding them raw venison. Now, and that
Yeah.
was it. Wrong in so many ways. Okay. And these dogs ended up with rickets. You
Yeah.
can't talk these
Yeah.
people out of it, because when they read something, they think it's the Bible because it's in print.
Yeah.
But you know what the
Yeah.
dog owner's thinking? Well, that's what they would eat in the wild.
Oh, please don't even go
I'm
there.
just telling you.
How
I'm
many
just
times
telling
have
you.
we heard that? Yeah.
I know.
Yeah.
I'm just saying. But as a consumer, when you go even at the grocery store, it's a whole aisle of treats.
Yeah.
And they're hot dog shaped and they're cute. And I
Big
kind of
money.
stand,
Big money.
mm-mm.
Mhm.
Right.
Ingredients vetted. I mean, even one of the big pet food companies a couple years ago didn't vet one of their suppliers, and it was high
Mm,
in vitamin D, and a lot of dogs got kidney failure from that. So, and
Yeah.
it's one of their things they promised to do, and they dropped the ball. And that's what always scares me, that we're depending on these food companies. And that's why when Cheryl said she mixes, cooked meat and potato and quinoa, I do the same thing, because I'm afraid to keep them on just that diet in case somebody screwed up somewhere, you know?
Yeah.
mm.
Mm,
Yep.
so
Good to
sad.
know. Well, gosh, thank you so much. This has been fantastic and
I
Oh,
know.
you're
really
welcome.
I hope we
informative.
didn't bore you too much with our Novotny
No,
upbringing.
not at all.
There's a
Not at
lot
all.
more to tell. A lot
Yeah, there's
more.
a lot, and it gets uglier. I'm just curious, Neil, were you brought up natural hygiene? Like, what inspired you to do this holistic? Did you just get sick of the commercial dog food mantra, or what?
Well, it was a slow introduction. I had back surgery in high school from football,
Ugh.
Oh,
and my mother was a medical receptionist, so there was no way that a chiropractor was going to get involved. Um, and there weren't. I can think of I was in Painesville, and there was probably one chiropractor in town. Even that was probably it. But when I got into vet school, I had knee pain from running and just all the sitting for studying and everything. And one of my classmates suggested a chiropractor in Columbus, so I saw him a couple of times. And then when I got to Minnesota, I was still having knee pain, and as a graduate student, my health coverage um, covered acupuncture, even way back then.
wow.
Really?
So I saw a physician that was trained in acupuncture. There's a course at UCLA for physicians. I don't know if it's in existence any longer, but he was trained in that UCLA course, and he started treating me, and the rest is history.
Wow.
There was another, I just listened to a webinar by another certified veterinary acupuncturist. She had knee surgery and, regular medicine. And after the surgery, the orthopedic surgeon said, this is the best I can do. You're not going to be able to run anymore. And she was a runner. And that got her interested in veterinary chiropractic medicine and acupuncture. And now she's running like crazy, and she does what you do for her patients. So it's interesting. You were both inspired by an
Mhm.
orthopedic injury.
Yeah, it's very common. I would say the two most common reasons for veterinarians to get involved in this work is a personal health crisis,
Right.
or patients that get problems that can't be resolved with traditional care.
Right, right.
Mm.
Well, Janet, this has been great. Next,
Thank you.
Janet, next time you're in
You're welcome.
town, we're dropping in on him.
I am. I need
Good.
a little work.
No, you won't say that, because you won't be able to get rid of us, and you're busy. And I know how when people would just drop in.
You don't
Oh my
want us.
God.
You know,
I'd
I'm
be like,
quickly
tick, 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 tick.
well,
We'll bring over
It's a
that.
Love to see you guys.
Janet,
It's a
we'll
pleasure.
bring over the dugout pizza to him and his wife.
We'll surprise him.
Yeah.
There you go.
This has been great. So till next time, I'm Dr. Alice Novotny-Jeroman.
And I'm Janet Novotny King saying thanks for joining us. Don't forget to like, review, and share us because we need a lot of these. Keep them coming. Thank you so much, Dr. Sivula. We appreciate you. Thank you.
Thank you.
You're
Bye.
quite welcome.
Bye.
Bye.
Hey, thanks for tuning in today. We hope you found the science-based information provided helpful in taking care of your pet. Check out our other Speaking of Pets episodes wherever you get your podcasts.
We'd love to hear from you. So email your pet photos and/or pet peeves to contact@speakingofpetspod.com. Remember to follow Speaking of Pets on all social media.